have your son or daughter perform an ACL injury prevention program. I saw in my office, this must have been just 2 or 3 days ago, 16-year-old kid on a competitive club soccer team, travel soccer team. They travel all over the southeast of the United States. And he had suffered an injury where somebody hit him on the side of the knee. He fell to the ground, couldn't keep playing. Comes to me, we examine him, and he was so swollen, he was so stiff, we had to get an MRI because you couldn't get a great exam. Saw him back, like I said, a few days ago to go over the MRI results, and he had torn his ACL. Now, I tell you this story because not so much about his injury, but his reaction to the injury. As you would expect, he was devastated. I mean, you could see big, muscular 16-year-old kid, but you could see tears in his eyes. Now, he needs surgery. He is going to miss the rest of the season, and the team is very competitive. They are going to be competing for championships. He's going to have time away from his teammates, and he doesn't know if he's going to be ready. He probably won't be ready to play for his school in the spring. He was absolutely devastated. Now, I tell you this because we can at least do some things to bring down your chance of suffering an ACL injury. Or if you're an adult and have kids that play sports, we can bring down their risk of suffering ACL injuries. I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on all sorts of sports and exercise injuries and injury treatments and injury prevention for athletes and active people, probably much like yourself, so that you can stay healthy and perform your best. These ACL injury prevention programs, you may have heard about it, you may not. They've been around actually longer than you think, probably since the early 2000s, mid-2000s. They actually started probably earlier than that, but the first one that really caught storm was one that was called the PEP program. It was designed by doctors and physical therapists in Santa Monica, California, who were basically the healthcare providers for the U.S. women's national team. And honestly, they got tired of seeing the girls and women on the U20 teams and the younger teams have so many ACL tears. They told me they did the physicals for this current U.S. women's national team, the one that won the Women's World Cup in 2015. They did the physicals, 25 players, 9 fingers, 9 of the 25 of them had already had ACL injuries and ACL surgery. What is that? That's a huge percentage, almost 40%? So we need to come up with ways to decrease that injury risk, and that's what they've done. And there's a variety of programs like this, but they created a program that's basically a set of exercises that you do every single day. They basically, instead of your warm-up exercises, for 10-12 minutes, you do specific exercises to train your knee and to train your hips. Basically, you're learning ways to land correctly and ways to jump correctly. They're pretty simple exercises. There's some strengthening exercises for your hamstrings and for the muscles around your hip, but it's focusing on control of your body as you land and as you turn, so that you don't, in the course of a game, be it soccer or any other sport, you don't put your knee in a bad position, when you land, suddenly, or when you turn suddenly, because that's how you tear your ACL. They're non-contact injuries. So if you can basically learn to land better and turn better and strengthen the muscles around your pelvis and your hip and your leg so that you have control of your lower extremity when you do land, you're going to have a much lower risk of tearing your ACL. Different studies show that you can drop that risk 30, 40%. Sometimes people say it's 60 or 70% decrease in the chance of tearing your ACL. My 16-year-old soccer player may never have missed his training and his competitions with his travel team or his school team. And you're thinking, I don't want to do exercises every day. And yes, you have to do them every day. But imagine, at the end of the season, you're not sitting on the bench or sitting at home not with your team. You avoid a surgery. You avoid 12 months or more of time with a physical therapist, just getting your knee motion back and your strength back. Imagine how much better off you would be if you could avoid an injury just by doing 10, 12 minutes of exercise a day and you have to warm up anyway. You just get rid of your normal warm-ups and you do these. I don't see that much downside other than maybe they're a little monotonous, but again, you gotta warm up anyway, and maybe you don't prevent every ACL injury, but I would imagine, just ask the athletes that you know that have had ACL surgery, ask them if they wish they had done an exercise program like that before. Would they go back and do it again? I bet they tell you they would. Okay, have you had an ACL surgery and do you wish that you had done an ACL injury prevention program? Or, do you have a son or daughter that plays soccer or football or basketball or any sport that puts you at risk for tearing your ACL in your knee? Would you consider having your son or do a program like that? I would love to hear your thoughts. So below this video, share your comments. Let me know if you think it's a good idea. Have you tried one and didn't really see any benefit to it? Whatever it is, good or bad, I would love to hear your thoughts. And I bet people all around the country, athletes all over the world, would love to read what you have to say as well. If you like videos like this and you want more information on sports and exercise injuries and injury treatments and injury prevention, subscribe to my YouTube channel. Click the button in the upper right part of this page. You'll get videos on ways to stay healthy and perform your best delivered directly to you. And if you know people who have kids who play soccer, basketball, football, or any sport that there's a risk of ACL injury, please share this video with them as well. Don't forget to subscribe, and thank you so much for watching. I hope this video was helpful. Think about those ACL injury prevention programs, and I look forward to seeing you right here next time.